Everybody, you know what time it is? Time for another Adapting With, brought to you by AAF Pittsburgh. Today we have Dean Walters. Dean, say hello.
My name is Dean Walters. I'm the Vice President and Chief Marketing Officer at UPMC, a 21 billion global international healthcare organization based right here in Pittsburgh.
And how long have you been at UPMC and in this role?
So in this role, it's going on about 13 years now. Prior to that, I was the Vice President for Public and Government Affairs at Children's Hospital. And prior to that was at Duquesne University and McKeesport Hospital for a while.
And, obviously you have a lot of experience before the last year of craziness ensued. So we're we're almost exactly a year since everything the world flipped its head. So what's that transition been like for you and your team and kind of managing the marketing of obviously a major, healthcare institution?
Yeah, so it's actually been good. I know a lot of businesses and companies have struggled having to make that transition. For us, it was a little bit easier. I'll tell you though, kind of an interesting story here. Prior to COVID, I was talking with the leadership group because we had really overgrown our footprint here in the office. And what I mean by that is there was just we have a large staff and there just wasn't enough room to accommodate everybody. And so I was talking with the VP group about establishing a work from home program, and in particular the digital and social folks were very resistant. Like, oh no, we need to sit down, we need to interact, we need to be in front of so I kind of, had decided, okay, we're not going to do it. And for the record, we were already doing 1 day a week working from home. But after that meeting, I kind of walked around saying, okay, we got to figure out an alternative, because if that's not going to work, if people need to be in front of each other, then we need to find where we're going to get additional office space. Well, along comes COVID and immediately forces everybody to do a work at home type of environment. And I will tell you, we haven't missed a beat. In fact, it's really been interesting to see how the teams have overcome any obstacles to be able to, meet the need. And, because UPMC is a healthcare organization, it was deemed essential workers. So for myself, I've been in the office. It's like a normal, pre-COVID type of situation. Have been in the office, although I could run through the halls and scream and probably no one would hear me. Very few people are here, but the whole moving to online, I'm talking to you right now, you're right here. You're one dimensional, but you're right here. And we're interacting as if you were physically here. Because UPMC has so many hospitals that are physically separated out into central PA, this has actually afforded those employees to actually feel more part of the team. Because prior to COVID, what would happen is we would take time to, get a conference room, schedule time to come in, and because of the distance, they wouldn't come in, and then you had the lack of really feeling a part of the team. That's not the case now. Because of this, I can instantly talk to somebody and see them working up in Harrisburg just as if they were in the cube outside my office. So it's really been it's been better, I would say, improving kind of our communications with the staff and making them feel like they're part of the team even more so.
That's some great insights and good positives too of people at obviously being a larger footprint organization, having individuals that are outside of the city, right, and be able to communicate with them. And that kind of leads into my next question. It was like, obviously you're semi-prepped already for work from home because you're trying to implement that just from a business standpoint before COVID. But how has the communication changed, or what did you adjust to make sure that everything that did work well in the office space when people could be there or had to be there, translated to keeping that culture and productivity, outside now that people are more dispersed?
Yeah. So a couple things, and it was really started with the leadership group. We were already from a equipment based. We were already prepared. So I had mentioned earlier that the team was already working at least one day a week at home. So they had the PCs, they had the laptops, whatever was needed. So we were great in that perspective. But really, what the difference was talking to the leadership group with regards to how often they're reaching out to the staff, maintaining regular communications. This is like, all marketing, communication, advertising. We all have deadlines. The deadlines have to be met. And if they're not, and there's a problem, let's address those up front and see what those are. So, really, I have to say hats off to my management team, because we didn't miss a beat. In fact, if you think about it, we had our normal everyday job, which we were now doing at home, but we actually had an increase because, given COVID and the need for information out, and so the web team and the social team were constantly updating and building new features and so forth to keep the community informed. We are required by the state to actually create a registration for the COVID vaccine. And, people are just thirsty for information about that. And we've really tried to position ourselves as the go-to place for the most up-to-date information.
On that note of having to require registration, right, for the COVID vaccines, what else have you had to adjust or kind of, get used to, or changes that need to be made in order to adapt to, the climate?
The first thing that comes to mind is just the outreach efforts. So, for example, we have really put a stake in the ground behind LDLT, so living donor liver transplants. And one of the biggest issues with LDLTs is a lack of awareness of actually what it is. And real quick, it's where you take a piece of a donor's liver and give it to the recipient, and both go off and live happily ever after. And we put that stake in the ground because of the fact that so many people were on the transplant list. About 14,000 each year die while waiting. So in order to meet that demand, we've really said, cadaveric isn't the right way. It shouldn't be the first option. LDLT should be. So as part of that, you wouldn't think you would need to go and educate gastroenterologists and hepatologists with this procedure, but there's really a lack of awareness. So to answer your question, we found it challenging. What we used to do is take one of our transplant docs out to, the University of Kentucky or, a lot of different health centers and do grand rounds and educate them about this procedure. That all came to a halt. Physicians going to conferences, it all came to a stop. And so we really had to think out of the box on how to reach them and how to work differently. And, one of the big things, because conferences stop, and that's where physicians go for CME, we have a whole physician resource section where we, in partnership with the University of Pittsburgh School of Medicine, we give the, continuing medical education credits. So we were able to really kind of use that as, there's a value prop to it. We're not just here trying to sell you on something. We're here to educate you, and you actually get credits for that. But I will tell you, one of the things that we saw is because New York was getting hit so hard with COVID and we weren't, what we saw was physicians were actually referring the patients. Like someone who is dealing with liver disease, that disease didn't stop progressing because of COVID. It continued, and those who were struggling with liver disease still needed to find ways to seek care. And what we saw was actually a very large number of physicians from New York were sending their patients to us. While we may not have been seeing the numbers here, our physician expertise was still being tapped to help the folks up in New York.
What do you think's worked best for you during this crazy year of COVID?
Communication. And I know that's such a generic kind of not to do a cop out type of response, but you can't take it for granted. It's not because you just can't open your door and pop into someone else's office and have a conversation. I made a concerted effort to do Teams meetings where the entire staff, not at one time. I went around by area to area, and have been doing kind of a conversation like we're having right now. And it's amazing. Something that you might have thought no one would ever ask, they're asking. And which means it just has proven the point that don't assume, have those conversations. And, the big question is that the staff's asking is, working from home, how long will that continue? What's the game plan moving forward? And my perspective has always been, if I don't have an answer to your question, I'm going to get an answer to your question, and I'll get back to you.
And on that note, like, how have you personally even managed? We all have to kind of take a break, right, to make sure we can come back the next day or maybe the next hour, and knock something out. How do you kind of disconnect yourself a little bit and get yourself the ability to reset so you can dive right back in?
One, surround yourself by good people. I have a great team, and I'm a strong believer, not to get all cliches, but you're only as good as the people you surround yourself with. And so we've all stepped up to be able to do that, and they watch out for me. I also have a 2-year-old who keeps me, extremely mobile, which instantly you walk into the house and you get that daddy hug, and it's, whatever was worrying you about the day is gone.
Those are 3 excellent points. This experience of the last year, what in your perspective kind of needs to be changed from the marketing side of healthcare, or, adjusted, et cetera?
Now, what we're seeing is urgent care, for example, the numbers are significantly decreasing of the people going to urgent care because now they're using telemed in replace of that. And if you think about why urgent care even got a footing, it's because, primary care, we all want to go see our primary care doctor, but primary care is open 9 to 5. Mm-hmm. Well, what happens when you come home and your spouse fell and needs to, it's not really an emergency room type of thing. Where do you go? Well, that's how urgent cares kind of got born. Well, now that you're opening, telemed up until, late hours, there's no need to get into a car and necessarily go unless it's a broken bone or something severe. So a lot of that, especially colds and flus, can all be addressed the way we're doing it right now, via telemedicine. So it's been an interesting thing to watch, how consumers now have accepted that and embraced it. The one thing that I would add to that is, if you think about it from a talent perspective, if you require somebody to come into the office, they have to live pretty, locally. Now what you've done is, because we're able to work like this, you could be in San Francisco right now, and we could, you increase your talent base because of that, and you've improved the work home life of your employees. There was a saying that once heard, and I'll never forget. And every day's a work day. Some days just have different views. So that's really kind of the situation here. I've said it a couple times, but communicate. And to be honest with you, this is, it's not necessarily what you're saying; it's that you're saying something, and that willingness to communicate. Being isolated, being home. Again, I keep saying it's like being on an island further away. We've got to go out of especially as managers, to not let that happen, not let a talented employee feel like they're out on an island and, they're out there by themselves. We've got to be open to new ideas. And, but I would say if in our field, if we're not open to new ideas, then maybe you should look for a different career. Like this is something that this field is we're always pushing the envelope, trying new things. It's just unfortunate that it took COVID to kind of move things along.
Dean, thank you so much for your time today and the great insights about how UPMC has adapted to this pandemic. To everyone that's loved the show, subscribe, like, and continue to follow us. We have more episodes coming soon. Thank you so much, and have a good one.